The Minnesota Department of Health says a resurgence of COVID-19 is being driven by the Delta variant, which is responsible for 3 out of every 4 new cases. But as health officials urge the public to get vaccinated today, Kent Erdahl explains why a growing list of local governments and employers are issuing mandates. Kent?
Julie, just today, the state of California and New York City announced that public employees will soon be required to get vaccinated or face weekly testing. And the VA also became the first federal agency to mandate the vaccine for its frontline healthcare workers. And the Mayo Clinic says it will require shots for all employees. Now, each mandate comes with different rules and ramifications, but experts say they all mark the start of a growing trend. On a day when the VA and the Mayo Clinic are mandating thousands of employees nationwide get COVID-19 vaccinations, a group of nearly 60 major medical organizations issued a joint statement in support of all healthcare and long-term care providers doing the same.
We have some large organizations that have decided it is time. We have to do right by our families who are asking. Families, when they place loved ones, want to know, is everyone vaccinated? How many are vaccinated?
Patty Cullen is president and CEO of Care Providers of Minnesota, which represents long-term care providers across the state. She says mandates have been a tough call.
We will lose some workers.
But after months of advocating for education and incentives instead of mandates, she says providers, especially in rural areas, are concerned that staff vaccination rates remain far too low.
They're trying, but they're encountering just intense social media misinformation campaigns, which makes it very difficult for them to get someone convinced that it's safe.
In response, Sanford Health and Good Samaritan Society are also planning to begin mandating the vaccine beginning in September. Patty says more will follow in the next week or two, and her board could formally endorse mandates as soon as tomorrow.
You don't want to kill someone in your building. This variant is wildfire. And we know that the more vaccinated folks we have working in our settings, the less risk it is for those we serve and coworkers.
These mandates are already getting some pushback from the state nurses union. The Minnesota Nurses Association pointed me to a statement from the National Nurses United, which reads, union nurses have historically taken the position that we encourage nurses to get inoculated with proven FDA-approved vaccines, but making vaccination mandatory has serious implications when tied to one's employment, a policy decision we do not take lightly. The Nurses Association tells me grievances will likely be filed if these mandates impact job status or don't include some exceptions. But history has been on the side of employers. Essentia Health imposed a flu vaccine mandate back in 2017, and it was upheld in arbitration.
Wow, very interesting, Kent. Thank you.